Today on Primary Care, stroke, the medical condition that in just a matter of moments can leave its victims paralyzed.
I don't have complete usage of my right arm. I'm gaining usage of my right leg.
Hello, I'm Dr. Lonnie Joe and welcome to Primary Care. A stroke is a sudden interruption of blood supply to the brain. Strokes occur suddenly, oftentimes without warning, and they can leave the person permanently disabled, creating a hardship for the patient and loved ones. The statistics for strokes in the African American community are absolutely staggering. Blacks are more likely to suffer from a stroke than any other race in the United States, and they are more than twice as likely to die from a stroke than other populations. Research shows that high blood pressure is a leading cause of stroke, and 1 in 3 African Americans has high blood pressure. Additionally, obesity, smoking, diabetes, and sickle cell anemia are all risk factors for a stroke. Joining us today to talk more about stroke, how to recognize when someone is experiencing a stroke, and more importantly, how to avoid having one, is Dr. David Gaston. Dr. Gaston is a neurologist on staff at several local hospitals, including DMC, Sinai Grace, and Hopper Hospital. Welcome, Dr. Gaston, to the show. Thank you so much for coming.
Thank you, glad to be here.
David, when a person experiences a stroke, it can be a devastating thing. Unfortunately, there are very few people in our society who has not known someone, a loved one or an associate of some sort, or been around somebody that has had a stroke. What is the prevalence of stroke in our society today?
Strokes are very prevalent. In fact, there are about 780,000 new cases per year, of which many of those are actually repeat offenders. And so stroke is a very common, the third leading cause of death in the United States.
What is our modern approach to diagnosing stroke?
Generally, what happens is the patient goes to the emergency room. The emergency room then will do a series of investigations to diagnose stroke. There will be an examination, and that will be followed by imaging studies of various sorts. And the doctor will make a diagnosis of stroke based on the clinical and the imaging. The imaging may sometimes lag behind the clinical, because sometimes some of the studies may not necessarily show stroke right away.
So help the listening audience or the viewing audience understand the different types of strokes that patients can have.
Yes, we can divide strokes into 2 broad categories. Stroke can be ischemic, which means there's a reduction of blood supply to the brain, or a stroke can be hemorrhagic, in which we find that there is a rupture of a vessel. A vessel can rupture and bleed into the brain. Sometimes a clot can form and break loose, and the ischemic tissue or the stroke area can be reperfused by blood, so there's blood in the area of a stroke. But at any rate, it means that there's either a plugging up of a blood vessel by a clot, or a blood vessel ruptures. And there are different categories of stroke within those groups.
So a lot of times people will tell us that they had no warning signs whatsoever, but there are some times or instances when people will say, boy, I had a certain sensation. Are there any typical warning signs of stroke that patients should look for?
Yes, we use the acronym FAST, which isn't totally inclusive, but it's a nice little acronym to remember, and that is F is for face, and then A is for arm, S is speech, and T is time. We'd like to remind folks that if you think you're having a stroke, you should get to the emergency room right away. Don't even call the doctor. Call the EMS and get to the emergency room. Don't waste, don't delay, and let them see you in the emergency room and make a diagnosis. It's best to actually have the EMS take you there so that you get there within the period of time that we need to hopefully give you medications that can reverse a stroke. So any facial asymmetry, one side of the face looking different than the other, a change in speech of various types, and also weakness of an arm. Are signs. Now, there are other things that can happen as well. with a stroke, and trouble swallowing. There can be a sense of dizziness or things spinning around and things like that. But those are the major features of stroke.
So a variety of symptoms, but some that are more specific than others.
Some are more specific than others, yes.
Why do we see the people who have strokes, outside of those who basically have a bleed and those who have a bleed, why do some strokes seem to be more debilitating than others? Is that strictly the amount of damage that is done to the brain tissue?
Well, we have the same slogan, you might say, that the real estate people have, and that is location, location, location. It has to do with the location of the stroke. As you know, the brain, the purpose of the brain is to basically recreate the world inside of us. The mind is an invisible product of the brain. And what happens is that there are different parts of the brain that are responsible for doing certain things. And if you have a stroke in one part, it may not be as prominent as if you have a stroke in another part. And in addition, it's kind of like if something happens in the park, suppose somebody blows up a part of the park. It's different if someone blows up a part of a house because the park is not very, not many things are going on, and so there's not going to be a whole lot of damage. But if it blows up in your kitchen or in the living room, there might be a different consequence. So there are some parts of the brain that are relatively quiet, and there are other parts of the brain that are highly active or represent very active traffic of impulses. And those areas would result in a greater effect than those areas which are relatively quiet.
So back to the real estate saying location, location, location. As far as patients are concerned, they have to be educated post-stroke initially or eventually where the location was that the stroke occurred.
That is correct, and we can do various things. The neurologist can localize it based on the symptoms. In addition, we can use imaging studies to help us to localize exactly where the stroke is in the brain. And then we can make some decisions about what to do about the stroke. But, whenever you have one, the important thing is to get looked at right away and to get to the emergency room so they could hopefully break up the clot that caused the stroke. And that's why we act very fast.
We're up against a break, but when we come back, you'll hear how having a stroke has affected the life of this former newspaper reporter.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
Newspaper reporter Darren Nichols suffered a stroke while on the job covering Detroit city government. He is still recovering and telling his story.
My name is Darren Nichols. I am a former journalist, former reporter at the Detroit News, and I had my stroke on September 25th, 2014. High blood pressure runs in my family. I had been checking my blood pressure on my own, but there was a 3-month period where I had not checked my blood pressure. During that time, if you can recall, that was when we had the 2 power outages and the 2 floods in Detroit. And so it was a very hectic time that was going on. In addition to, as a journalist, bankruptcy was going on. You're talking about Mayor Duggan's first year in office. So there was a lot that was going on. And so as a result, I did not check my blood pressure for a 3-month period. And obviously that was when it spiked out of control. I asked my colleague, Matt Helms, for a glass of water. And he sensed something else was going on. And that was when he called 911. I didn't know what was going on, but they noticed some signs. They noticed some things going on my right side, and they also noticed that my face was starting to droop. And so from there, they knew something was wrong. When I woke up in the hospital, they said it. I didn't really recognize it because everything was going on. But obviously I had paralysis on my right side. Obviously my speech was slurred. I don't have complete usage of my right arm. I'm gaining usage of my right leg. Mentally, it is tough to deal with, but I think that I'm a very strong-minded, strong-willed person. So mentally, I get through it. I've completely changed my diet. I work out 3 days a week in physical therapy. I think that the key to dealing with a stroke and what I learned throughout this process is that it is a long-term process. And to know how to deal with small victories on a daily basis or a weekly basis. There's no magic formula that's going to cure a stroke. I think doctors have to understand what their patients are going through. I think that there are ways for doctors to, particularly in the beginning of the stroke recovery phase, to use, I believe that music is very therapeutic, and using music as a bridge between the doctor or the physical therapist and the patient. The message to African American men is you must stay on top of your blood pressure. You have to stay on top of what we're eating and things like that. You know, I went back and checked, you know, what I had in my body the night before my stroke. And I had enough salt in my body for a week. I had a week's worth of salt that was within my body that I had for lunch and dinner that night. And so, you know, you could say it was stress, you could say it was all of these things, but clearly my diet had a lot to do with, you know, triggering the symptoms of having a stroke as well. Having a stroke is a challenge, but you must embrace the challenge in order to move forward.
Mr. Nichols demonstrates great optimism and inner strength, which is essential for recovery. But his uncontrolled high blood pressure, stress from his job, and a poor diet were like a time bomb ready to go off. Dr. Gaston, this is a problem that we've suffered from a long time, patients having stroke as a result of high blood pressure. What has been your experience in terms of compliance, outcomes, those types of things, when we know that if the blood pressure had been controlled, we more than likely could have had prevented a stroke?
Well, hypertension is actually one of the major risk factors for stroke, and it is quite likely that a lot of patients who, if they did in fact control their blood pressure, would not have stroke, or if they did have stroke, it might happen later as opposed to sooner. Hypertension is a major risk factor for stroke, and control of hypertension certainly is a major therapeutic goal in reducing the risk of stroke.
Also stress. Mr. Nichols mentioned the effect of music therapy as something that could reduce his stress. Stressors are where we find them. It's kind of hard to tell people to cut out a stress factor if you don't know what it is. So helping people identify the stress is just as important as dealing with the stress.
Yes, stress is kind of a double-edged sword. Stress can be very helpful in making us better, because obviously if you're stressed and you're playing football, you might play better. But on the other hand, stress in terms of risk factors for some disease could actually make it worse. And so certainly stress can be an adverse risk factor for a number of diseases and can actually bring out those diseases under some circumstances. And certainly stress may increase the risk of stroke by doing things like elevating the blood pressure and maybe elevating the blood sugar, and also by causing certain adverse lifestyles that may predispose to a stroke.
We're seeing the age group that stroke affects coming down. We're seeing more people between 18 and 50 now suffering from stroke. Is there a real cause for that, or any risk factors that come to mind?
Although most strokes occur as we get older, at least about 28% of strokes occur under age 65, and so it's possible that even young persons get stroke. Perhaps the highest incidence may happen in actually premature infants and so forth, but we still have strokes even occurring in persons during teenage years and during the young adult years, and there may be several factors that may be associated with that. Certainly lifestyles would be a major consideration. Alcohol use, drug use, especially cocaine, amphetamines, these are major factors that may be associated with some risk of stroke. Some stroke risk may have a genetic hereditary basis, and some strokes may be associated with certain diseases that at an earlier age that are hereditary in nature. For example, sickle cell anemia may be associated with a higher risk of stroke, and that can happen at an earlier age. When we see stroke occurring at an earlier age, we look for various factors which are different than what we look for in older persons. Congenital heart disease, for example, tend to occur at the very earlier ages that we look for, but there are other abnormalities of the bloodstream or certain conditions like fibromuscular dysplasia, in which there's a higher risk of stroke as well because of abnormal blood vessels. Those are relatively uncommon, but certainly when a young person has a stroke, we put forth more effort to find various other causes of stroke.
Hypertension's partner, diabetes. Do you see an increase in the risk of stroke when the two diseases are present in the same patient?
Absolutely, and if someone has hypertension and diabetes, we're much more careful to control those than if they had only one alone. And so yes, it's more important to control hypertension in persons who also have diabetes. But of course, it's important to control hypertension by itself, but certainly if there's other risk factors, we certainly put forth more effort to do that. And of course, anyone who has hypertension and diabetes would of course not want to introduce a third factor, which would be cigarette smoking. Cigarettes, hypertension, and diabetes is a definite no-no, and that three combination is certainly something you don't want.
The deadly trio.
That's right, yes.
Great. We'll be right back. We're going to take a break, and we'll come back with more discussion on stroke with Dr. David Gaston.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
We're back with Dr. David Gaston, neurologist, continuing our stroke discussion. David, the African American community seems to be a little bit behind the curve when we get to stroke awareness. What can we do to elevate the level of understanding and acceptance of the prevention methods that we have in terms of stroke?
Yes, that's very important because it is true that we have a disproportionately higher incidence of stroke in Afro-Americans than we do in the rest of the population, with perhaps the exception of Alaskans and Eskimos, I believe. I think there may be a higher risk there, but otherwise I think we pretty much lead out in terms of risk. So I think it's important to probably stress lifestyle changes that might help us to reduce that risk. This includes changes in dietary patterns, activity patterns, and some things we may not be able to modify. There might be a genetic component that might put us at increased risk, but some things we can modify, such as the diet and our activity level. And also especially control of hypertension. We have also a disproportionate higher risk of chronic systemic hypertension and diabetes, and if we control those, we would probably be able to substantially reduce the risk.
So the recovery phase, rehab, costs, family issues, it goes on and on. Stroke is a devastating situation. I've had patients tell me, I would much rather have taken my chance on surviving a heart attack than suffering through living with a stroke. It can be a very devastating event for people. and it can be very costly. Talk to us about the impact that this has on long-term sequelae with patients and families.
There are several effects. There are psychological effects, there are financial effects, and there's also effects on one's other physical abilities to enjoy a meaningful life. Fortunately, these effects can be overcome. There's a significant incidence of post-stroke depression, for example, in persons who've had stroke. That can be treated, and there are medications available to treat post-stroke depression. There are also financial effects of stroke in terms of the ability to continue to work, as well as the cost of care, time missed from doing other productive activities. The physical limitations imposed by stroke can also affect on other persons who have to care for stroke victims. So we are aware of some of the costs, and these costs, of course, financial as well as non-financial. So certainly it's very important to keep that in mind in terms of whatever we can do to help reduce the incidence of stroke in terms of lifestyle changes.
What can patients and families do who can no longer afford the cost of care?
That's a good question, and we have available to people social workers who are very helpful in trying to help that out. It can be challenging to find adjustments, but these can be found with some appeal to social workers. And certainly when a person's hospitalized, the hospital will do a lot in order to get the patient adjusted so that some of these issues can be resolved. One of the good reasons for going into a rehab program after stroke, an inpatient rehab program, is a lot of these issues are discussed on the rehab unit with the social worker and other doctors to try to iron out how to adjust to these particular challenges.
What's coming down the pike? Anything that we can look forward to in terms of research or treatment, technological advances for stroke victims?
There's a lot of research going on now in terms of reversing stroke. I mean, in the 60s we used, I think we first started using TPA, but there's a disproportionately high amount of complications from bleeding from use of the TPA in those days. But we found out that if we could give the medication within 3 hours of an acute stroke, we could make a difference. And of course, that has substantially improved a lot of folks in reverse stroke in some people. We've also, and we continue to refine that. Now we can say 4.5 hours. But of course,
so it's been lengthened a little bit.
It's been lengthened a little bit, but don't take refuge in that. Go to the hospital right away. Don't wait, because the sooner the better. If you can get to the hospital within 30 minutes of a stroke, you're going to be better off than you get there in 3 hours. So you want to, because a lot has to be done before they actually start the TPA. And so you've got to really get there fast. Also, we're doing various mechanical forms of removing clots. Like if a clot forms, we like to inject that TPA to break up that clot. But sometimes we've got a little extra time if we can insert a catheter or special device within the blood vessel and actually mechanically remove the clot. And that can be done as well. And the devices that are used in removing clots are actually improving as time goes on, and these devices become very, very good. We're also working on certain medications that may protect the neurons from damage from a stroke.
David, thank you so much. This has been very informative. We've been talking with neurologist Dr. David Gaston, on staff at Harper Hospital, Sinai Grace Hospital at the DMC. We're not done yet. Stay with us. We'll be right back for some final thoughts.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
Some final thoughts on stroke. If you haven't been personally affected by it, I'm sure there's somebody that you know who has had a stroke, whether near or distant. Unfortunately, the research in this disease state is slow, and the prevention is not as adequate as we would like it to be. So, what can we recommend in terms of stroke? First of all, you have to have a good relationship with a caregiver that can counsel you in terms of prevention as best we can. Treatment of high blood pressure, obesity, food intake, treatment of diabetes. All of these things have been proven to decrease the incidence of stroke. Do we have much to learn and a ways to go? Absolutely. In the meantime, we should pursue these avenues so that we can produce better outcomes and better numbers in this devastating disease state. Thank you for watching Primary Care. We'll see you next time. I'm Dr. Lonnie Joe.